Okay. Yesterday I talked about scleroderma. I talked about what it was, how it affects people, and the fact that there are 3 different types. Going from really mild as just a skin condition to really severe where it can be life-threatening. I did a little bit more digging because I needed to find out if it was life-threatening and how long they're talking, as you know. I actually found that if it's life-threatening, they're looking at 5 to 15 years. As a life expectancy, that's not quite so good. 5 to 15 years, that's a good amount of time to sort of it's a nice chunk of time, but still, you'd hope to get the 15 rather than the 5, but it's because it goes from so mild to so severe, depending on which category you fall into, and because it can turn up any time, and can develop from other conditions, other serious conditions as well, like Sjogren's and Raynaud's, puts a whole other spin on this, and diagnosing it is exceptionally difficult, and I'm going to talk about that in a minute, because diagnosing this condition is extremely difficult, and treating it, although the treatment for this is actually fairly simple. Treating this is actually extremely simple. In reality, the treatment for this is far more simple than the actual diagnosis, and and living with this condition is the hardest part, I think. But diagnosing this, once you actually start feeling symptoms, getting any of these symptoms like the rashes or the thickening of the skin or the hypertension or any of the symptoms that I talked about at the end of yesterday's videos, getting a diagnosis once you go to the doctors is not easy, because it actually can be mistaken for either lupus or even like rheumatoid arthritis. That is really kind of weird, to actually mistake this for rheumatoid arthritis. And I think that's because if you go in there with no rashes or no thickening of the skin, just if you go in there because you're having joint pains or stiffening joints or things like that, it could be mistaken for rheumatoid arthritis. If you then get the rashes later and thickening of the skin afterwards, it just depends on how the symptoms appear on you personally, through you personally. If it's the joint pain and things like that first, it could be dark, you can imagine, So it could be mistaken for either rheumatoid arthritis or even lupus. But doctors will go through your entire medical history with you, take you through an entire physical where they will look for things like thickening of the skin and any kind of like red dots on your skin. Then they will do a blood test where they will actually look for something called an anti-nuclear antibody. Now, that antibody will show up in 95% of people with scleroderma, but it actually also shows up with people with lupus as well. So even though if it's present in your body, it gives you a high chance of giving them a diagnosis of scleroderma, there's still that small chance that you could be diagnosed with lupus. Yeah, it's scary. So it still could be misdiagnosed for lupus. But then they take you for a CT scan and check your lungs. So they'll look for your pulmonary function. So they need a lung function test. So you go for a CT scan. Then you'll do an electrocardiogram and an echocardiogram. So they'll check for any scarring in your heart, and they'll check your heart function. Because obviously scleroderma, not only can it cause scarring in your heart, but it can close off the blood vessels in your heart, so it can actually stop your heart functioning properly, as well as cause scarring in your heart. So they have to do both an electrocardiogram and an echocardiogram to check for both either damage or scarring, just in case it's either doing one or the other, or even both. Then you will be taken for a gastrointestinal test, and you will have an endoscopy, and they will check your esophagus for damage. Now, as far as I'm aware, your esophagus is somewhere around here, because the endoscopy goes that way. I'm pretty sure the endoscopy goes down your throat. And your digestional tract is somewhere around here. Pretty sure. I keep meaning to look it up, and I keep forgetting. So, yeah. Don't quote me on that one, because I could be 100% wrong exactly where it is. But I am pretty sure the endoscopies go that way, down your throat. Yeah. But I could be completely wrong with that as well. So. But yeah, you need an endoscopy to check your esophagus, and I am pretty sure your esophagus is around here. Could be completely wrong. Do not quote me on any of that, because quite frankly I could be 100% wrong in all of that, because I didn't look it up because I forgot. Completely forgot. And then they do a kidney function test, because scleroderma can cause kidney failure. But if, after all of this, you actually get diagnosed with scleroderma, right, the treatment for this is actually much more simple than you would have thought, because there is no cure. No cure, none. Okay? And again, if you have this condition and it is life-threatening, because you have the most severe version of this, then it is a life expectancy of about 5 to 15 years. But, you know, the treatment for this is all about management and control of the condition. So if they do find there is a possibility of things like organ failure, they will put you on the transplant list. That is a thing that they will do. So they will put you on a transplant list. Okay. And then there's like everything else they do is pretty much simple stuff, and then it's you managing, controlling and living with the condition and following their rules and regulations and doing as you're told. So it's skin treatments, so it's things like moisturisers, steroid creams, and even things called nitrates. Now the nitrates, what they do is they put nutrients back into your skin, and it helps to soften the skin and try to stop or help with the thickening, just try to loosen up the thickening or soften the skin. It's supposed to help with the thickening of the skin. So the nitrates are there to bring all the nutrients back into your skin. That's what the nitrates do. So they do that. So on top of the moisturisers and possible steroid treatments, they'll also help with things like nitrates to help you put the nutrients back in. Okay, so then we have things like digestive remedies, which are obvious if you're having digestive issues. So you're looking at things like antacids if you're having things like heartburns, then you've got receptive blockers like Santax, and they've got something called a proton pump inhibitor. And they use I'm assuming these are names of companies that make these. It's like Protonox and Nexium. Couldn't find the names of the actual things, but yeah. And they are there to actually just stop the build-up of acid and then to keep the digestive tract healthy. If you have pulmonary hypertension and they need to treat that, they will give you something called cyclophosphamide. It's a form of chemo. I had never heard of this. Now I've always thought chemotherapy is something they give to cancer patients. I've never thought, and I always thought it was something given to it was like a whole Body kind of thing. I've already assumed that it was like a whole body kind of thing, something like, because it's something they pump into your veins, isn't it? So it's like goes through your entire body. They attach it through a, can't remember the word for it. Anyway, they attach it. They do like your meds in the hospital. So they push it through your veins. So I always assumed, as it runs through your body and runs through your blood, it's a whole body kind of experience. I assume, and it's horrible. Chemotherapy isn't very nice. It did not even occur to me that you could have a kind of chemotherapy that is directed straight at an organ. Chemotherapy is something you get hooked up to a fucking banana bag, sat in a hospital with your arm as you sit there. Not have the chemotherapy at an actual organ. But apparently you can. Cyclophosphamide is a form of chemo that is designed to improve your lung function. Never in a million years would I have thought that could happen. But apparently it can. So, And then it is all about speaking to a dietitian, getting the proper diet in place. Then you get an exercise routine in place and a stress management program in place, which is completely understandable, because one thing you do not want to happen when you are in pain, when you are going through things like organ failure, when you are having issues with your digestive system, when you have those kind of issues, the one thing you do not want to be doing is sitting still. You don't want to lose the ability to move around freely, or you want to be able to keep healthy and exercise, even if all you're doing is like 10 minutes a day or half an hour a week. It's important to do that on a regular basis, and even if it is only 30 minutes a week, it's really important. So I can understand why an exercise program is put in place, and it's also really good for your mental health as well, because exercise releases all sorts of endorphins in your body and in your brain. Makes you feel really good about yourself. Now I suffer with chronic pain, as well as a movement disorder. So I really struggle sometimes to exercise. So I signed up, I pay a bulk amount each month to do online classes. And I have access to a whole bunch of online classes every month. I love my fitness instructor, she's amazing. And sometimes I just do the same 3 classes every month because I can do those classes. They're low impact and I can do them. And just because I'm doing the same 3 ones and she's got a whole library full of like hundreds of different ones, I can't do them. Physically enabled to do all of them. So I do the ones I can do. And it keeps me going. Sometimes I do 10 minutes of a different one. Because, just to try it out, to see if I can. But I have the ability to. It just keeps me physically going. It is so important for people with serious conditions to keep active, because mentally, if they don't, it makes them feel like they're really kind of lazy, or there's something. It makes them feel really kind of and lazy and whatever, and the whole world makes you believe that anyway. Especially if, like me, you're on the slightly plumper side. Because the world judges that. And they do. There's no point pretending that they don't, because they do. And it's really good for stress management as well. So not only does it help with everything else, but your actual mentality, it actually helps reduce your stress. And stress management is also a massive part of what the treatment for scleroderma is. And it is, they tailor their stress management around the person with the condition as well. Now I have a stress management program that I follow. I don't follow it to the letter because it depends on how I feel at the time and on the day. But I do follow a stress management program. In fact, I've got about 3 different stress management programs depending on how I feel. So people with these kind of conditions, especially with a program, especially with a condition like this. So if you have a condition like scleroderma and you're put into a stress management program, it's really helpful to have more than one, because there will be days where that stress management program will not help, and you'll need something a little different. I've got about 3 different programs that I mix or that I use on different days. I mix and match them. It's always helpful to have more than one stress management program in place if you are going to need a stress management program as part of your treatment for your conditions. Always. It's absolutely imperative to have more than one, because there will come a point where that one won't help anymore. Because they just, you'll get up one day and go, do you know what, I can't do that today. It's like, no. So and then you'll feel lost and stressed. Exercise helps with stress. Well, it helps me with stress. It helps my son with stress as well. Exercise can help some people with stress. It doesn't help everybody with stress. I know that. I know it doesn't help everybody with stress. But it can help some people with stress. There are a lot of reasons why having an exercise program for people who have conditions like scleroderma is really important. But having a proper stress management program is also important, and having more than one is even more important. So that is all they do, and then it's all about you and how you as a person manage and control your condition. It's about then living with the scleroderma after that. You then have to follow all the doctor's recommendations, you have to then follow all your regimes, you have to do as you're told, you know. Doesn't mean you can't have any fun. Just because doctors have given you your limitations doesn't mean you can't have any fun. It's about you then learning your own body, your body's limitations, and understanding that if you do certain things, this will happen to you. And as long as you stay within your boundaries and your lines, and you don't go against the doctors too far, doesn't mean you can't have fun. You know, it's, even if it's the most serious form of scleroderma, doesn't mean you can't have a life. You know, you just have to be careful with it. But you can enjoy it. Anyway, I'm going to go. I'll see you all later.